Today we'll discuss something that a lot of patients ask me when I see them in the clinic, and something that makes them really apprehensive when they meet me for the first time. And that is what to expect from the first consultation. After all, when you choose to see a surgeon, you have to see a surgeon because you've been diagnosed maybe a cancer or any other thoracic problem that is addressed by us. You're naturally apprehensive because maybe you heard stories from relatives, friends, or you read the news and you got scared about surgery. Quite often I have patients that come to me and they say that they had friends who had a particular operation, they spent a long time in hospital and they were debilitated afterwards, and obviously that affects a lot the decision making, and sometimes patients end up probably making the decision that are not objectively in their best interest. So what happens when you come to see me? Well, I will do my very best to counsel you for an operation, to give you all the instruments that you need to make a decision. And actually, I will try to understand what you know already about your condition and what you've been told, because sometimes confusion generates from the fact that being given or you got incorrect information. I will also discuss at length the alternative treatment, because of course the consent for an operation is informed, that you might well decide that an operation is not the right strategy for you. But if you decide to go for surgery, well, I can assure you that I will be with you all the way until you get discharged from hospital and afterwards, and if you need any further treatment, I will organize that for you. I'm lucky enough to be part of a group that deals with all chest conditions, so whatever your need is, I'm sure we can provide that. Moreover, we can schedule an appointment whenever is good for you, so you don't need to kind of chase me relentlessly or come to a time that is not convenient. We will also, most of the time, arrange for the investigation to be done the same day of your consultation. Obviously, we cannot do all of them, but CT, MRI, probably we can do it the same day in the vast majority of cases. I will also spend quite a lot of time trying to get to know you and really understand what you need. I will try to get what your medical problems are and what they've been in the past, because of course that will affect the conduct of the operation, or indeed whether an operation is good for you in the first place. Essentially, we will decide together whether the benefits far outweigh the risk. If we are in a situation where the benefit and the risk are more or less the same, probably an operation is not for you. And if it's the opposite scenario, when the benefits are here and the risks are very high, definitely an operation is not for you. But that does not mean that I can't help you or I won't be able to take care of you, because I will refer you to the appropriate specialist for your condition. We'll also discuss at length what to expect immediately after the surgery, during the surgery, in the immediate postoperative period, and then during the next few days, weeks, and months after surgery. So essentially, I will give you all the information that you need to really face this problem with kind of peace of mind. A lot of people have experience of thoracic surgery with something from many years ago or even just a few years ago, but our specialty has evolved dramatically in the last few years. And I can tell you that in my case, the 25% of patients that have major lung resection go home on day 1, 50% go home on day 2, and 25% of the patients stay 3 or more days. So this is a pretty good statistic, and even is when you look at my data that are collected nationally, the length of stay for lung cancer resection in my cases is 1 day less than the national average, and this is thanks to the great work that my team does to make sure that you recover as quickly as possible from surgery. We will mobilize the day of surgery and we will implement a number of measures to make sure that the surgery is the least invasive possible, and then you could go back pretty soon to your normal activity or continue with the care for your problem. So the first consultation is essentially just a long conversation where we get to know each other, and you will have the chance to ask me questions, and decide whether you want to trust me to do your operation. And I will try to answer your question in an honest way and in a simple way that you can understand. So if you still have any doubt about surgery, or if you also been given the go-ahead for surgery elsewhere, but you still have some doubt, give me a call and I'm more than happy to have a consultation, hopefully make things clear.